So next would be myself. So I'll be presenting on 4 haptic design, enhanced monofocal IOLs. So basically the EDOF lenses, or the extended depth of focus IOLs, they were introduced with the idea of bridging the gap between the monofocals and the multifocals, and to give you the best of both worlds. And the lenses which are available today in this category are IC08, Symphony, AT Lara, BBT. These are the common lenses. Now, what is characteristic of these lenses, these EDOF lenses, is a depth of focus which is around 1.75 to 2 diopters. So this is the list of all the commercially available EDOF lenses, and you can see that most of them are having an depth of focus which is around 2 diopters. You can see here. Now, however, so this 2 diopters of depth of focus is actually good to give good intermediate vision. However, these lenses do have some limitations, such as the IC08 was known to later have a loss of light, basically because it works on the pinhole pupil concept. The Symphony or AT Lara basically has a diffractive design, hence definitely you can expect halos and glares. And the VBT in many studies have found, it has been found that it can lead to some amount of loss of contrast sensitivity post-op. So even though they give good intermediate vision, but then they were found to have limitations in the long run, and also in clinical studies which were published. So this is where the role of enhanced monofocal IOL comes. And these lenses, I would say, score over the traditional EDOF lenses, because they have, although a slightly smaller depth of focus, which is around 1.5, however, they do give functional intermediate vision along with a good quality of vision. So you are getting functional intermediate vision, but without any kind of compromise on the quality of vision, no halo glares, no contrast disturbances, and also no drop in the distance visual acuity. So I'll be talking more about the ISOPure Serenity and Serenity Toric technologies from BBI. And Dr. Anurag has given a brief overview about these lenses, but I'll be discussing more in detail. So basically, the Serenity is, so now we have this ISOPure Serenity and Serenity Toric, which is actually the second generation of the ISOPure enhanced monofocal lens, which was already available to us in India. So this lens was based on this 4 closed haptic design with posterior haptic angulation. So you can see that this design is very characteristic. This is 4 haptic design. And these haptics are closed. This is a looped design, also known as the bunny design. Now with the Serenity and the Serenity Toric, basically these are the ISOPure generation 2 lenses. And how they are different from the ISOPure, essentially the principles of working are same, but they differ in the design of the lens. And also now the Serenity Toric will be available. It is already introduced in Europe in many countries, and it was introduced in the last ESCRS conference, which was there in Barcelona. However, it is yet to be introduced in India. So that's an update from the ISOPure on the ISOPure lenses. So when we say this word ISOPure, if you break it down, basically ISO means equal. So it is used to describe a uniform increased defocus. Pure means, as we understand, it is not mixed or adulterated. So it's clean, clear, and refined. And it is used to describe the hydrophobic material, which is free from any impurities or glistenings. And Serenity, which is the new word, which is now the new term, these lenses will be now known as ISOPure Serenity and ISOPure Serenity Toric. So Serenity, as we understand, is the peace of mind. And this aims to deliver to both the surgeons as well as patients peace of mind through trust, which we already had in the ISOPure optic, combined with the pod platform, because now these lenses are available on the pod platform, which is the open loop design. So this is the isopure serenity features. So you can see this is the new design, which was already available on their monofocal toric platform. So this is the pod design, which is a double C loop design, and you can see some ridges on the haptic. So this is called the ridge tech technology. The lenses also have posterior angulated haptic and the overall diameter of 11.4 millimeters. So basically, this is the Serenity Toric, essentially the same platform. Now these lenses are able to correct a cylinder of up to 6 diopters on the IOL plane. So the principle on which these lenses, which is the isopure Serenity and Serenity Toric work, is also discussed in the previous talk, but I would go further in detail. So what this isopure technology aims at, it basically aims at providing you with a consistent depth of focus in each eye, and how it achieves is basically by incorporating spherical aberrations across the full optic diameter, and not only on the full optic diameter from center to the periphery, but also on both the surfaces, both the anterior as well as the posterior optic surfaces. So unlike the other designs where the spherical aberrations are introduced in the center, let's say in 1 millimeter or 2 millimeters, here it is basically incorporated on the entire optic, and this gives it two advantages. The first advantage is that it gives you a consistent depth of focus, and secondly, it makes it pupil independent, as was discussed earlier. So due to this, what you achieve is a range of vision wherein this was compared with a monofocal lens, which was the isopure, which was the monofocal of from the same company. And what you see here in this diagram is that the isopure Serenity provides a depth of focus which was approximately 50% more than the monofocal lens, and with only a 12% decrease in the maximum MTF. So this is equivalent to approximately 1 diopter of extended depth of focus, which is slightly more compared to some of the other models discussed previously. And again, this is another study where you can see that at the 1.5 deep focus point, the isopure Serenity provides an intermediate vision of 0.2 logmar, which is an excellent intermediate vision. Now, how it is able to provide a consistent depth of focus across all ranges is, again, we come back to the isofocal technology. So we said that here the aberrations are introduced on the entire surface from center to periphery and on both the surface. But furthermore, what happens is that here they have also adjusted the value of the negative spherical aberrations as per the individual lens power. So this is something which is very unique to only these lenses, wherein you see that depending upon the lens power, these aberrations are customized. So if you have a myopic patient, so we say that standard corneal aberrations are 0.27 microns. That's a standard spherical aberrations. However, they differ in myopic patients and hyperopic patients. So when you see a myopic patient, on an average in myopia, you have about 0.24, which is slightly less than the average. And a hyperopic patient will have slightly more, like a plus 0.34 than the average. So these are the positive corneal spherical aberrations, which vary depending upon myopia or hyperopia. Now, if you do cataract surgery for them, you will have to implant a lens of myopic or hyperopic power. So their curvature and shape is going to change. So we understand a lower positive power lens will have a concave convex curvature. You can see here plus 10, it has a different shape. And of course, for a hyperopic lens, as you go higher with plus 35, it's a biconvex shape. So with the shape, ideally the aberrations should also change. The aberrations induced on the lenses should also be customized. This is what is done in isopure technology, the isofocal technology, wherein the other technologies, it is a fixed amount of spherical aberrations which is incorporated. So they do not consider the power and the curvature of the lens into account. And here in this technology, this is done. So this is why you always get a consistent depth of focus, whether it's a myopic patient or a hyperopic patient. And I am also seeing this practically in many of my patients, this result. So due to this, what you get is the right balance of the range of vision and the quality of vision. So if you compare the isopure, the with isofocal technology, quality of vision versus the depth of focus, on the extreme right, you see that it is well balanced, the quality of vision and the depth of focus, whereas on the second one, you can see this is versus the other lenses, other enhanced monofocal lenses, you can see there is some amount of asymmetry. So those lenses with the, excuse me, the myopic lenses will have more depth of focus but a less quality of vision, and as you go towards hyperopia, the quality of vision is more but the depth of focus achieved is less. So you can see there is some amount of dissymmetry, but with the isofocal, despite the power of the lens, you can see that it is very well balanced. So the quality of vision and the depth of focus are balanced with this. Also, the quality of the GFY material, which is used to manufacture these lenses, has been shown to have a very low PCO rate. And this essentially is based on the no space, no cells concept, which basically was a concept introduced by Dr. Linola's sandwich theory. And this is basically done to provide a perfect bioadhesiveness, to provide a hard tackiness and bond to the capsular bag, so that it sticks well to the capsular bag and prevents the migration or the proliferation of the cells. And it also has a two-step technology which features a square edge barrier and posterior haptic angulation. So this also offers protection against PCO. And in long-term studies, it was found that the PCO rate was very minimum. And this is a study which had long-term follow-up of 3 years. And they found that only 1 out of 43 eyes at 3 years underwent YAG capsulotomy at 37 months. So coming to the stability and coming back to the pod design, so this design essentially aims to provide better stability, positional stability in the capsular bag. And how this achieves this excellent stability is because of the double C-loop haptic configuration for excellent fixation within the capsular bag. So it provides 4-point fixation, and this offers low tilt and axial displacement because it is so stable in the capsular bag, it does not really tilt, so it is tolerant to some amount of tilt and decentration, and is also very stable in the bag and has excellent rotational stability. So if you see this diagram, basically it has a greater contact angle. So why this pod or open double C-loop design is considered to be more stable is because of its greater contact angle. Here you can see in comparison to a C-loop design. So a C-loop haptic design, which is actually the overall length, it has is 13 millimeters. Now when you compare the contact angle, which is shown by these red arrows, you can see that the 4 closed haptic design, this is of course this is the older one, but this goes, the design of the open C-loop, which is the pod, is actually more stable, and it provides you with 70%, more than 70% contact angle because of its 4-point stability, 4-point fixation. And what it offers additional stability to the lens is the ridge tech technology. So you can see that there are some ridges on the haptics. This essentially reduces the risk of sticky haptics on the optic during and after the injection. So when you're injecting the lens is folded, so it does not cause those optic haptic adhesions, and it opens smoothly and does not stick. So this design, because you can see that it has rounded edges, so it is easy to maneuver in the capsular bag. So unlike the traditional C-loop lenses, which can be rotated only clockwise, this particular design can be safely rotated in both clockwise and anti-clockwise direction without any additional trauma to the bag. So I would just show some of these studies which have shown that the double C-loop design is very stable, and in this particular study they found that the rotation at the end of 1 year was only 1.22 degrees in the toric models, which is phenomenal. So coming to my experience with the isopure enhanced monofocal IOL, of course we are waiting for the Serenity and Serenity Toric, but so far I have a vast experience with the isopure lenses. So this is the data from the first 25 patients. So 20 IOLs were implanted for the 10 bilateral patients. The first eye was targeted at emetropia, or the first plus or minus, whichever was the least. Second eye operated within 2 weeks, and the second eye was targeted at 0.25 to 0.5 diopter minus after considering the first eye outcome. And if the patients desire to read better, then we also did up to 0.75. So here you can see the surgical implantation of the isopure. So some surgeons feel that it is technically more challenging. However, I don't think so. If you use the right technique, it is not very challenging. So here you can see that how I am implanting it. So it's very important that the leading haptic should first go in the capsular bag, and then for the trailing haptics you can actually just use your second instrument to gently push those trailing haptics into the capsular bag. And it is better not to do a wound assisted implantation initially in your first few cases, because if you do a wound assisted, then the trailing haptics will be released on the iris, and then you might have to struggle a little bit. So if you are well inside the anterior chamber when you're implanting the lens, you don't face this problem. So these were the results at 1 month, binocular results. Mean post-op UDVA was 6/6, 0.3 logmar. Mean post-op CDVA was 6/5. Mean distance corrected intermediate vision at 66 centimeter was 0.14, which is around 7.5 to 6.9. Distance corrected near vision, since we also did mini mono vision for most of our patients, we checked the near vision as well, and this was excellent, N8. Or every patient was actually able to read N8 with both the eyes, and some of them were also able to read N6. So mean post-op spherical equivalent was plus 1.12, and none of the patients reported any halos or glares or starbursts. So about the post-op reading addition, and this is the data for the 20 eyes. As you can see here, most patients, that is 18 patients, required only a reading addition of plus 1.5 or 1.25. So the need for reading addition also actually reduces. And this is the comparison of the internal MTF with a Technis 1 monofocal of isopure. And you can see here the average MTF height with the Technis monofocal and isopure is quite comparable. So Technis 1, as we know, is considered as one of the standard and gold standard lens to be compared. So it's quite comparable with Technis 1, and this is the subjective contrast sensitivity for topic. Again, isopure versus the Technis 1, where you can see that it closely matches the subjective contrast sensitivity on CSV 1000. And when you increase the light basically in the photopic condition, you can see that compared to a Technis monofocal, it very slightly drops only at higher frequencies, which is expected. So to conclude, the isopure enhanced monofocal IOL, in my experience, provides excellent functional intermediate vision, which was consistently seen as 0.14 logmar or better in all patients, and some amount of functional near vision also. You can do a mini monovision of 0.5 diopters safely with these lenses. So this will help to reduce the near ad. Absolutely no drop in the distance visual acuity when you see these patients with both the eyes, when you measure the distance visual acuity. No halo glare or any kind of compromise on quality of vision was observed. Very high patient satisfaction. All patients scored over 95% on a scale of 100%. And I feel that these excellent results are achieved with a combination of closed pore haptic design, and now of course the Serenity, which is the open, and the pod design, and the glistening free material, the isofocal optic. All of these in combination provide excellent quality of vision in all varieties of eyes, irrespective of the myopia or hyperopia or the pupil size, angle kappa, alpha. I think it gives very consistent results in all types of eyes, and the patient satisfaction and surgeon satisfaction is also excellent. Thank you so much for your kind attention.